moving to the central region, specifically at the Kasoa Polyclinic, where we understand they are having challenges with their liquid waste management. There's a very big problem there, to which reason is having a toll on the Walantu community in the area. So let's bring you this report filed by our Central Regional Correspondent, Akwesi Akwesi Ado, and later we would have conversations with him and authorities as well. Please stay with us.
For several decades, or even since its establishment, sewage from the Kasoa Polyclinic hasn't been discharged through a proper system. From the Central Business District area, waste from the facility runs down south through Walantu, a highly populated community. Complaints from residents have always been taken lightly.
Nsuo na toilet ni na mu baba nanam ha so mu bie sen ya woti ha untimi nya home kan
uko other hospitals na omo wo ma ho a blood ayini nyina begum but we do ma link to the outside of their wall awiabo na hu once na wa ha say any smeller among for smelling.
Some opinion leaders say management sometimes release human excreta into the open.
They pump out their fecal matter as soon as they perceive that it's about to rain, whether it's day or night. They just go there and pump out their fecal, and then the whole area is engulfed in some terrible stench. We've complained to hospital administrator after hospital administrator, but it looks like they are not bothered.
But here in Walantu, a large fish processing facility is established. The fish processed from this hazardous environment is put on sale to mass consumers on the local markets within the municipality and other areas. There exists other food joints in the same enclave, meaning any outbreak in infections could be volatile.
In the high papa say, when we say quiet toilet in Sweden, can you quite find in Nippon say 8 years in Sunum? Ye adwuma so wa ha omototo nam market no modeko nti abana san nsuo no ewe ni mo ha ya ye tie mu de bia ebi wo ho a wotie mu a ne nsuo na eyu na wo da fom ene nam ni nyina ebi wo be 7-8 no mo ebie toilet nsuo no ne nam ha ne mpampa na fan so saa
bibi men nam na me patre me buo mu bam me buo mu pa ya me ja papa ebi mu nsuo ina.
Residents of the Walantu community are demanding for management of the Kasoa Polyclinic to pay attention to its waste management system.
Every year, the situation in our area rather deteriorates instead of improving. It poses grave danger to the health. Sometimes you see children walking into it and picking things from it. It's a very terrible situation.
Some residents have blamed the environmental department of the Otusenya East Municipal Assembly of poorly managing the situation, even after several complaints.
Tama tankers for ye jumano na omu ye jumano ya mo mu brofudini de monyo omu ni mu hwe omu nya hwe na omu tie ase o ma so mata de efro mu fie no ma betron bo so me so no ma gipe.
2 weeks ahead of this report, the Polyclinic's management had pledged to take action. Godson Lodo, the municipal environmental health officer, equally noted that his outfit was handling the matter. But no action has been taken yet. Both the Polyclinic and the Environmental Health Department of the Otusenya East Municipal Assembly have denied to comment on the issue.
So this is what the residents of the Walantu community are battling with, what is coming from the Kasoa Polyclinic. And this is very sad, because you wouldn't want to stay in a community where you'll be battling with what is coming from a health facility. And mind you, a health facility, there are a number of things they are dealing with: liquid waste, hazardous waste, and even the solid waste. So it tells you that a lot of work must be done. But Our correspondent Akwesi Ado is on the line. He filed this report for us to really understand what is happening there, and also the backstory, when this actually started, and for how long has it been going on. For that reason, the residents are complaining about the issue. Akwesi, good morning.
Good morning.
First of all, I want to thank you for this story. It's a very good story, and I want to find out from you, from what you gathered on the ground. So when did this start?
Okay, Philip, thank you very much. So let me first of all emphasize that this has been a prevailing situation for decades since the establishment of the Kasoa Polyclinic. This has always been the situation. Just behind the fence wall of the facility, and then a section of the Walantu community. And even though residents have been complaining about it consistently, the facilities management has not taken any pragmatic steps to address this particular situation. Anytime they try doing something, the measures they institute isn't sustainable enough, and then residents would go back to witness this very unfortunate situation, Philip.
Yeah, people who live around it, and also people who actually deal in food items. What has been their concern regarding this? Have they tried going to the facility, that is a Kasoa Polyclinic, to at least speak to these individuals to do the right thing?
So, Philip, the Kasoa Polyclinic is situated within the heart of the community. This is the central business district area we are speaking about. And so it tells you that the place is very populated. And the Walantu community is one of the earlier communities that were developed in the Awutusenya East, or the Kasoa municipality. Now, residents have been complaining about it, just as I mentioned earlier on. At some point, it even gets confrontational. So, in our story, you saw us speaking to Mr. Francis Gasu, who is a lawyer by profession and has lived in the Walantu community for several decades, even before the establishment of the health facility. And now, at a point in time, he went there because the facility were discharging the septic tank into the community because there was a sign of rainfall, and then after they discharged the waste, it didn't rain. He got there and it became very confrontational between him and then some staff of the facility. So occasionally, some members of the community visit the facility to draw the attention of authorities to have this matter addressed. They have also taken steps to visit the municipal health, the environmental health office at the Outbreaks East Municipal Assembly. The officers would come around, they would just survey the area and then return, but nothing concrete would be done. So just about 2 months ago, the facility decided to find a solution to the problem. But what did they do? They just looked for some PVC pipes and then channeled it through the community. But because that wasn't a sustainable measure, the PVC pipes got burst, and then the community members came back witnessing this situation. Now, with respect to this fish processing facility that is within the community, the wastewater from the Kasoa Polyclinic runs just beside their wall. And one woman was telling me that sometimes they even slip and then fall into the waste that is running through the area, and then some of the fish would fall into it, but they would have no option than to pick the fish, wash it back, and then sell it to community members. And fish from this particular area enters the Kasoa Old Market as well as the Kasoa New Market, and then market centers in adjoining municipalities like the Gas South, Gomua East, and then Awutusenya district, Philip. And so we're really dealing with a very difficult situation, and residents are sitting on time bomb because should there be any outbreak of infections in the area, it is really going to be a very volatile situation.
I just want to know, so when I've actually visited the facility to talk about the issue, what were the words from the heads of the facility? What did they say before they actually had to, put in their makeshift system that still did not work?
Okay, so Chris, the facilities history also comes at play here, because you know that previously this was just a small health facility, and then it became a health center. Then it attained a clinic, a polyclinic status recently, and so management comes, management goes, but the situation remains. So when we contacted the current medical superintendent of the facility, Awo Johnson, what she told us was that they were really putting together resources to find a lasting solution to the problem. Except to say that the municipal assembly, that is the Otusenya East Municipal Assembly, may also have to intervene, because there should be the construction of a proper drainage system that would help channel this wastewater from the facility to another bigger drain also in the Walantu community. And that kind of project is beyond the capacity of the polyclinic. But I've also learned that when we put out this story, the hospital's administration have started taking steps to solve the problem. But again, the solution they are finding for this problem is also not sustainable.
Has there been any outbreak of disease?
The Otusenya East Municipality 2 years ago suffered an outbreak of cholera, but we cannot link that directly to the conditions in the Walantu community.
Well, we know this polyclinic was established in 1983 at a health center, and eventually got the status to be a polyclinic in 2012. So will you also say that from what you gathered, the numbers around the polyclinic has sort of increased, and that was what may have accounted to the insanitary condition?
Exactly so, because the polyclinic was first of all established at its location, because at the time of the establishment, if you spoke about Kasoa, that was the real Kasoa. So the real Kasoa had just a few communities at the central business district, or what has become the central business district now. So we had the Anakope, that is the high tension area. Then we have the men's committee, and then we had the Odupong Zungu, and then the Walantu community, which is where the polyclinic is situated. And so even at the time the facility was being established, there were quite a number of residential facilities in the area. And then now that we're speaking, the numbers have actually increased. There has been new buildings, there has been the moving in of new households into the area. This is a very populous community, one of the most populous communities in the Otusenya East Municipality. And so, yes, the numbers have also increased, and then some activities of community members are also contributing to this particular menace, because there is no proper drainage facilities in the community. And so, even wastewater from residential apartments also run within the community without passing through any proper channel.
I can see, like you indicated, the numbers have increased. But when you visited the area, I don't see any proper sanitation management in the area itself. From what I'm seeing on screen, is that how it is? Like every part of the Walantu community?
Philip, as a matter of fact, sanitation within the Walantu community is very poor. The environmental department attached to the Otusenya East Municipal Assembly, headed by Mr. Godson Lodo, haven't done their best to help manage sanitation in this community. Now, even the fish processing facility I spoke about, apart from the polyclinics wastewater running beside the facility, the sanitary conditions surrounding that particular area is very poor. Even within the facility itself, sanitation there is very poor. And you wonder why health officials would sit and watch food prepared from such environment entering into a market that serves several thousands of people. And so something drastic must be done. Even apart from finding a solution to the situation being created by the Kasoa Polyclinic, there should be pragmatic steps to address sanitation conditions in the Walantu community. And I'm sure that accounted for the Autusenya East coming last but one in the last ranking with regards to sanitation here in the central region.
Finally, before you take leave of us, the situation that you can see on the ground, when you visited the area, the residents themselves also say that they would help address the situation, especially within their community, because as we are seeing or learning from you now, what the Kasoa Polyclinic is doing is having a toll on the community. But what are the residents themselves doing to keep their surroundings clean?
Exactly so. The residents, they remain committed and are ready to collaborate with the facility, put resources together, and then find a more sustainable solution to the problem. But it looks as if some of them told us that they haven't had that kind of the facility or the management of the Kasoa Polyclinic hasn't shown any sign of collaborating with them to find a lasting solution to the problem. And so what they are looking for is that the facility would engage property owners in the area so that they come together and then solve the challenge.
Okay, Akwesi, thank you so much for your time, and definitely we will definitely come back to you again on issues of sanitation within your region. Chris, this is troubling because looking at what we saw on screen or what we are seeing now, it's something that must be worked on immediately. The Kasoa Polyclinic that I just made mention of, that was got its polyclinic status in 2012. That particular facility includes productive and child health, disease control laboratory, maternity, children's and outpatients department. So what we understand here is it's a 80-bed capacity project that was put up in 2019, and this is different from the old building. But we will ask the authorities, should we get them the details of this particular facility.
It's ironic how a hospital can be the one causing filth.
Well, I'm trying to understand something here. Maybe it could be that the community developed around the health center. So if a community is developing around a health center, it now brings in the districts or the municipal or whichever assembly it is to now try and find ways and means to get the community sort of to do their things well, or the health facility to do their things well, so that it doesn't have what they are doing in the facility will not have a toll on the community that is growing.
I feel like from the beginning, when the community actually reached out to them to come and see what they are causing, I think they should have done something about it. You should have been a bit proactive about that and not leave it to linger for a long time. You understand? I feel like it lingered for too long.
We would have to find out that from the assembly. But most of the stories we've done here would has to do with sanitation. You see that either it's a dump site or it's a refuse dump or whatever. The community tends to grow around that particular place. Well, so maybe it could be that the community eventually got around the health center, because in 1983
but even at that they should have had like better ways of channeling their waste, because what you're saying right now is they were there before the community. So okay, imagine the community is not there. That means that we will still see filth.
But it also comes with town planning.
We will still see the fecal matters floating around.
But
Yes, there's no community. But flies, the flies will touch it and still travel to another community.
We're here where we saw, I wouldn't want to say an issue in Tema, where somebody went to block a sewer system.
Yes.
You understand?
Yes, yeah.
So it's a bigger issue with the assemblies that they have to check these things. Because if you are building a community and a community that is growing around a facility, there should be a way that you can check the town planning part of the community. You wouldn't have people building anywhere. You wouldn't have people putting up structures indiscriminately, because even if I'm just doing the devil's advocate here, that even if this particular facility wants to now construct a proper drainage system, it may affect already existing buildings.
Well,
yes,
that's another angle.
From what I'm seeing on screen, I'm not seeing a proper community there. What I'm seeing is sort of like, I wouldn't say it's a slum, but it's a disorganized community. So if it's a very disorganized community and this community hasn't got what it needs for the drains to really be channeled well, for structures to be put up well, for even the facility, that is the Kasoa Polyclinic, to also come out with plans to address this issue. Because now, from what Akwesi told us and what we saw on screen, is that now the facility has now channeled a tube,
a makeshift tube, which still didn't work, from
the hospital or the clinic to wherever. So it's a bigger problem. I think it comes to the doorsteps of the municipal assembly. We're just hoping that we will speak to the MCE and also the other authorities within that area, i.e. especially the management of the facility, because we can't battle with any health risk or any outbreak in this particular community. That's the Walantu community. But this brings to a bigger conversation that we really need to invest in sanitation, because I'm sure that if maybe this facility is having a challenge and the Ewutu Senya East Municipal Assembly is well equipped and these sanitation officers can go out and get enforcement done, I'm sure that we may have seen something better in this particular community. So it brings back to the question of we investing in sanitation, because we keep talking about sanitation issues here for quite some time. And every person you talk to talks about how capital intensive it is, or we need resources to do this, or we need resources to do that. If the resources are given, then you can hold people accountable. That is not to say that people are not supposed to do the right thing. But what we need to be done right now is that the community has to be checked, by the assembly. The management of the facility must also put in place measures to address this entirely, because you wouldn't want to say that you had the polyclinic status in 2012, and 2012 to date is still like that in the area. It's just appalling. And when Akwesi spoke to the market women or the people who live around that particular place, they complained about seeing fecal matter in the drains there, seeing blood stains in the drain there, and seeing other things that is really helping or really affecting the people in the area. Let me bring you this story. So Kasoa Polyclinic, 80-bed polyclinic left unused after 2 years of completion. So but this is a story that was filed somewhere in 2019. But this story tends to give the whole understanding that this particular facility has been there for some time, though there were part of it that were unused, but now that is being used tells you that people are now going there, because what Akwesi said is that people are now using the facility. And when you talk about the only polyclinic in that area, it's Kasoa that we would go to. But anyway, we have Seth Saba Sewonu, who is the municipal Banini, who is the municipal chief executive for the Ewutu Senya East Municipal Assembly. We speak to him and find out from him what he's doing and whether this has come to his attention. Good morning, sir.
Hello, good morning.
I trust you're doing well.
I'm doing well.
Well, we are doing good. First, has the issue of the poor liquid waste management of the Kasoa Polyclinic come to your attention as the Municipal Chief Executive?
Very well. Thank you so much for the opportunity. I like to say that the Municipal Polyclinic in Kasoa have been a place that we have been partnering in development over the last few months when I assumed work as MC. I remember sometime last year, similar issue came up, and we went in to address the issue. This time around, it was the frontage of the facility. So we quickly got in to address the issue. Sometime within last year too, we went there to cut source for the construction of a 30-bed pediatric block, construction of first phase pediatric block for the polyclinic. Up until now, this particular issue that we are addressing had not come up. My checks with the facility managers and sanitation officer gives me some first-hand information, and myself have been around the place to ascertain the issue.
What is your side of the story? What have you picked up? Because you are saying that this hasn't come up. So what is your side of the story?
So the issue about the fecal matter discharge into the facility, when I interacted with the medical superintendent, she tells me that they contracted one of the artisans, that is a plumber, to do some work, and the artisan did a shoddy work, left it halfway and then left. I was surprised because we have had very solid relationship. We have technical men within the municipality to even offer some technical assistance when it comes to matters like this. But to go off and then get someone just by the roadside to do a shoddy work for this development to happen, that is the discharge of the fecal matter, it was unfortunate. Quickly when this matter came up, I got in touch, and then they came in to lay the pipe. But a broader issue about the sanitation issue, you realize the drain issue towards the Walantu stretch proper needs huge funds to complete. At the other side of the road, there is a contractor that is working to develop the drain, that is general construction from that side. Once that gets connected into the main drain, the assembly will mobilize funds to address this particular issue. I've been watching your event in the morning. You talked about this being an old settlement. That is true. This settlement has been there for so many years, even before we started work. But we are mobilizing from the assembly a joint task force to address the situation, especially when we have people vending food from that place, to make sure that we do not go back into the coroner issues that were recorded 2 years ago.
I want to find out, will it be very difficult if the hospital now wants to fully construct a drain that will be channeled into the bigger one that you said the contractor is putting up? Will it affect structures? Because what we can see on screen doesn't look like it's an organized community.
Yeah, this has been an unplanned settlement for many years. And so any major structural development that would have to come up, certainly some existing structures will have to give way, which we would have to consider the greater good of the entire municipality than one or two structures that would have to give way. So it will not be difficult with proper engagement and public education. And then we'll look at resettlement of the affected people that would come up. Again, most of the places, most of the places there are also unauthorized. So when we go in with our technical men and realize that an unauthorized structure is in the way, that one, there wouldn't be any compensation to you. But those that have legally acquired their documents and they have developed within our spatial plan, those people will do some few things there. So expect us to move in there to have the situation changed shortly.
But no timelines yet. Just indicated that shortly.
The nature of the issue is that consultations and all that, but we are moving in. I won't give you timelines, but work will be done shortly. You can have assurance.
I don't see the Walantu community as a very tidy community. What is the problem when it comes to sanitation management in that community?
There are broader sanitation issues within the area, and see, when people do stuff the wrong way over a period of time, it assumes the order of the day. These are practices that were happening before we assumed office, and it will take a good number of efforts to undo all those practices, which we are doing using public engagement, public education, to get them to understand the health risks associated with this. Hence, the need for us to push through. We have been facing resistance, but that's not the issue. We make them understand why we need to undertake that.
You made mention of resistance. I want to find out from you, are there challenges you face as an assembly should you move in to ensure that people do the right thing in terms of tidying up their communities or getting sanitation bylaws enforced?
Yes, we have difficulty, but even yesterday I chaired a NUSEC meeting to discuss some of these developments, and the decision of NUSEC have been adopted. We have a few resolutions that we intend to employ to make sure that some of these resistance are brought to the barest minimum. Like I told you, people have lived there for several years and they have conducted their business. Previous administrations have moved in with little effort or with no effort at all. And so over time, these people think and own a certain ownership of the place and want to attempt to block any further development that would help them. When you move in there, they will first of all want to, because their properties will go in the first place. Some might lose their livelihood. They would give you the impression. But through the public education, let them understand. And if the forces still persist, NUSEC comes in, we have the security backing for us, and we do the right thing. I keep saying that the very decisions that will give us the desired results as a municipality, they are not pleasant to the ears, but we still need to take them anyway, and that is where NUSEC comes in for us to do the right thing.
Now let's move again and talk about the Kasoa Polyclinic. This polyclinic, we understand that acquired the polyclinic status in 2012. I'm sure that from 2012 to 2026 it should be some 14 years. What is the status of the facility now? Has it become a very big facility, and how many bed capacity is it now?
Very well, thank you so much. So the Kasoa Polyclinic has been in existence for a very long time. I am 26 years in Kasoa, ever since we moved from Accra to the place. That is where we've been having our health needs met. Not just people within Kasoa. We have people coming from adjoining urban areas to come and seek medical conditions there. As we speak now, the bed capacity is about 42. And that has been the status of the Kasoa Polyclinic, the one adjacent the overpass. Until the construction of the now named Mother and Child Polyclinic at CP by President Alma in its former administration, that was the only public facility there. And looking at
hold on. Did you say it's a 42 bed capacity?
Yes, as we speak. It's a 42 as we speak now. Until last couple of months when I left in there to construct a 30 bed capacity pediatric block to bring it to 75 years completed. And the sad thing before I came into office was that children were sharing the same ward our women, our mothers and our women. And if you understand health, you may realize that healthcare delivery is quite different from the adults. And so the risk of medical complications and all that were issues. At the point in time, I've toured the facility a number of times when I started work. The places that were supposed to be used for, to host children and all that. The places have been used to store medical supplies just so that they don't go with it. So there is much congestion. It is out of this that we quickly planned, made the necessary arrangements for the construction of the first phase of a 30-bed pediatric block with its ancillary facilities, which will be completed by mid-year or in the course of the year, so that we can detach the children from that particular place to their new ward and create more room for our women to have. But that is not the only medical intervention that my administration is doing. A couple of months back, we went in to donate some medical supplies and equipment to the New Market Health Center. And as I speak with you now, I was saddened to be briefed that a municipality as big as Kasoa that have people coming all the way, sometimes from south, Kumwa, east, which is in our coming sick medical care. We do not have a functional anesthetic machine within the municipality. 2 years ago, I was told a pregnant woman lost her life because of malfunctional anesthetic machine. As I speak with you now, we have made arrangements in a couple of weeks. We are going to donate a brand new state-of-the-art anesthetic machine to the mother and child. That is part of our broader healthcare needs to the municipality. As I speak with you now, because mother and child and then polyclinic are overwhelmed, sometimes the health needs that come up from our community, they are not supposed to get these major facilities. The major facilities are designed to handle certain special and specific diseases, but they end up being overburdened with issues that could have been handled at the chip compounds and all that. So as I speak with you now, when we go to Opekuma, their healthcare, we are almost completed with a maternity block for them. In about 2 to 3 weeks, we should hand over to the Municipal Health Director to work on. When you go to Iron City Health Center, we are doing a major renovation there. Gada would also see one. And then there's another health center at Opekuma too that we are doing some work there. And there's a deliberate effort to also make sure water runs through the place. So when you go to Iron City, we have drilled a borehole there to help them with their water supply. And that of Opekuma too, we have done that. These are all pockets and pieces of actions and investments we are going to help our health facility within the municipality. Then this coming week, the Mother and Child Hospital would have a full functional anesthetic machine to help with that people. Prior to my coming in, it wasn't there. And
good. You've made mention of a number of things. A story that I just pulled that I was about reading before we noticed that you were on the line. It's a story that was done in 2018, July 18. And this story is about an 80-bed capacity at the Kasoa Polyclinic at CP in the Ewutu Senior East Municipality of the Central Region that has not been put to use since its completion nearly 2 years ago. What is the status of that particular facility? Is also not being used as we speak now?
Yes, so that is what I refer to the mother and child. Remember, I indicated that that particular facility was built, completed by President Mohammed's former administration between 2015 and 2016 when that facility was put up and the president went out of power. So when the administration, the Nanaro-led administration came in 2016, between that and 2018, we agitated and made a lot of calls for that facility to be opened up to be used because of the pressure that was on the Kasoa Polyclinic then. It was after our agitations that that facility was commissioned for use. So that
is being used now. That facility is being used.
Yes, that is what they renamed as the mother and child.
Mother and child.
Just so that people will not know it was constructed by President Mahama, but that is the handy of President Mahama.
So mother and child, 80 bed capacity, and the original one that you also stated is 42 bed capacity. That's it, right?
That is the 42 bed capacity.
So in all, it's about 122 bed capacity. That's it.
That's right.
Good.
That's
If
right.
a facility which is 122 bed capacity is not having a better drainage system, that is a big problem, and I think that it should be worked on immediately.
The mother and child is situated at a different place. The drainage issues there do not have a problem. The Kasoa Polyclinic is at the central part. Like I told you last year when I made my fiscal visits to most of the health facilities we got there was a similar issue but had to do with the funds. I made sure it was redressed. And this particular one, the Kasoa Polyclinic management contracted an artisan by the roadside that led to this particular problem. Then the bigger community issue that is there that I'm telling you, we have men on standby to move in to make sure we get a few things corrected.
Okay, so as you speak now, just for us to get the specifics right, the challenge we have with the poor liquid waste management has to do with the 42 bed capacity.
Exactly, and not the mother and child.
Mother and child. And is there a way that 42 bed capacity will get some extension, or there will be some renovation that will be done? That will be growth.
As you speak now, I told you about 3 months ago, we cut short for the construction of a 30-bed pediatric block, the first phase for it. Some other works are ongoing with that to make sure that we have the facility opened up. People get to patronize that because of its proximity to town and all that, especially are moved to the mother and child. So we are working on, my administration is working on something over there. We have a solid relationship with the management there. We are working on that and any other medical facility within the municipality.
So, Honorable, we'll be holding your account and we'll be following up on what to be happening in the area. But let's talk about Kasoa in general. How is the sanitation situation there like? I know when you came, you've done a few things at the Kasoa Central, that's the CBD, that is the Central Business District, and among other places. How's the general sanitation situation there like?
There is a tremendous improvement in our work. Evidently, people are giving us some thumbs up. We are not carried away by that. I must say some notable figures within the opposition have come out to comment our work, but there are still more to do. Sanitation issue has improved. You wouldn't see this visible heap of rubbish that hitherto time was around the key point around the Central Business District. And then also remember when we came into office, in my first 4 days, myself and then my Honorable MP, together with the Assembly, put together the Maiden Sanitation Dialogue that brought together a lot of stakeholders within our space to brainstorm about the issue. Some of the resolutions that came out from that meeting have been put to or have come to fruition. First among them is the securing of a dumping site within the municipality. Prior to me starting work, we moved to Gumua East. That is 2 constituencies away. That takes us about 4 to 5 hours to shuttle or to haul one skid track of refuse from the Central Business District to that site. So we quickly started engagement. I put together a team of engineers, the Mehu, other people to look at a site that we could use. After we were given a green light, we partnered with a private company to acquire the place, and then that has become our traditional dumping site where we can also we are in talks with people who can be turning some of the refuse then into other reusable stuff. That is number one. Number two, another resolution was to make sure that we get pickup sites within the municipality. It emerged that areas that were earmarked for pickup sites have all been taken over by the rapid development that so happens. So what is displaying now is the dredging of the Okudu River. I'll talk about that. So we came up with, the proposal to build 3 pickup sites at vantage points within the central business district. 2 of them have been completed, and the specific locations are before the Okudu Bridge. That is, if you are from the new market towards the central business district. And then another one is after the Okudu Bridge, if you are from the Obom Road. These are nice places. I would send you some visuals for you to share with the public, or I would come to the studio so that we can talk further about it. These are places that we are going to stock with at least 3 skip containers. There is a place for an attendant to man the place. And the idea is that the residents who live in and around the central business district, and then the old market that is closer to the central business district, research shows us that majority of the generation comes from them, and they claim they do not have a place within their space or their town to dump these refuse. So they find it convenient enough to leave it by the roadside. That's what the name that we have, the bad name we have. So with the coming in of this, what we are going to tell our residents that they should not leave it by the roadside. You just take it to these pickup sites, and the positioning is very is to the advantage of them. If you live around the American town area, the high tension area, you just need to come to where like it should be. If you live on the Obom Road, Jones, Pomote, that area, you only need to come to where the scrap people are, and then you dump there. A truck will come lift it. And the rate of our refuse generation demands that we will not want to wait for one skip container to be full and spilling over before we lift it. We'll have about 3 of them there. So by the time the first one is almost full, our attendants there will signal the necessary officers on board. We dispatch a truck to it every day to lift it and then bring it back. We lift one, there are 2 still there. And then those on the other side of the main road, that is the old market area, the main lorry station, that is the 3rd pickup site that is going to come up. Within 2 weeks we should finish, so that the refuse generation that comes from the old market, they don't leave it by the roadside. They also bring it to the pickup site for our cars, our skip trucks to come and pick it and then move it to the dump sites like that. These are major interventions that we have done. I've certainly had engagement with the sanitation workers, motivate them, and then also get them to keep working. But we realize that after we have cleaned the place and left to do other things, people just hide out. And the way they even carry the refuse, they package it very nicely. I think they have gone to shop in town. Upon crossing the road, they watch left and right. If no one is paying attention, they leave it there. And that is where our task force, the municipal task force and the sanitation task force, have come in to help us arrest a few people, which we have arrested and then prosecuted a few of them to serve as deterrent to other people who want to do that. As we do all these things, the main interventions are on each way to ensure that we move through.
Yeah, very good work. Before you take leave of us, just 2 questions. Are you doing this with support from a private entity, or everything is being done from the assembly's side, that is the government? And of course, again, will you agree with me that we need enough resources, i.e. funds, to deal with sanitation situation in this country and also in your municipality?
Thank you so much. So the pickup site is being handled by government, and in this case the assembly. So the construction of the pickup site is solely done by the assembly. That is the 3 of them. I already indicated that the acquisition of the dump site was in partnership with a private body to acquire and own the place, secure and own the place. With the coming in of the modern escape container trucks, we are in talk with a private entity to supply us those containers and the escape truck to furnish not just the pickup sites, but also public places like our schools, lorry terminals,
you mentioned private entity. You want to know which private entity are you collaborating with to deal with these things before we come to whether you think we need enough funds to deal with sanitation situation in this country?
Comes to the pickup sites, we partnered with Al Huda Company Limited. They are our primary partners to secure the dump site. With the skip containers, I would not to disclose the identity now because we are stalling talks. We have not finalized the agreement. Once we finalize that, we'll make that information known to you.
Okay. But the final question that I asked, you think that we really need enough funds to deal with sanitation issues in this country?
Sanitation is something that has come to stay with us. If you check the data, generation can only go up and it will not come down. So all efforts would have to be channeled through to the management of it, which requires huge capital to do that. As we invest huge capital, the very people that do that need education and a change of mind. That is one of the things that almost brings down our effort to ground zero. And so enforcement comes to deal with that. We need huge capital. My municipality needs huge capital. The next time you invite me to your studio, I'll come with solid data on what we have, the rate of generation, the influx of people, the effect of the influx of people that come in that affect us negatively when it comes to sanitation. All these things, as part of policy information to address this, funds cannot be taken out, and we would want to call on strategic investments with this to handle this particular issue, which we are having that discussed and under control.
Very much, Seth Sabah Sawonu Banini, who is the Municipal Chief Executive for the Ewutu Senya East Municipality. Thank you so much for your time. But then again, we'll be following up keenly on what will be happening for the Walantu community, following what they are battling with, the liquid waste that is coming from the Kasoa Polyclinic that is having a toll on their lives. Chris, I think everything has been said. And I like the fact that the MCE has waded into this conversation and he's actually indicated that something is being done about it. We also understand that some sort of meeting has been had by the management of the facility and also the environmental health officer, I think, at the facility, that's the Kasoa Polyclinic. So we'll be following up keenly. Whatever issue it is you'd want us to also speak on when it comes to that, or how best you'd want us to also add up our voices to this particular issue from the management side. Well, we are here for you so that at least we can talk about this and people will know that you are doing something about it. But we wouldn't want maybe few weeks or few months or years to come, people within the Walantu community will be having issues because of waste, waste from the clinic. And I think the MCE also stating that there is a bigger picture with the drains and all that. I think it shouldn't be something on paper. It has to be done. It has to manifest.
Well, like you said, it has to manifest, but remind me not to eat a smoked fish from that area.
You may not know. You may not know.
But remind me not to eat a smoked fish from that area.
At our various markets, someone is selling salmon. What when you reach the market, the market woman says Simon.
Simon.
They are selling smoked fish.
Yeah.
And others will also want to use that smoked fish for your light soup.
I know, right?
Or for that nice eba you would have.
So now you know what you're doing right now?
What am I doing?
You're actually now giving me like anxiety.
Yeah. So you see. What we pick from these places, we forget that eventually it will end up on our plate.
On our plates.
See, you think that is far away from you. You think that we are talking about Walantu community, which is in the Ewutu Senya East
so it has nothing to do with you here.
So it has nothing to do with me. But just close to it is a place that they are smoking fish.
And the women say when the fish fall into that drain, they just take it and wash it back.
You don't know whichever chemical may have been, or whatever has been used at the facility, and has gone through that in what drain or whatever it is, and has gotten into the community,
which we still have to eat.
Yes. So you'd go and buy the food, or you go and buy the fish, or whatever they are selling. It ends up on your plate. You eat, and the next minute you'll be sick.
You don't know where
it's coming from. So
like you promise yourself that you cooked well. I'm very hygienic. I did this. I did that.
So it's interlinked. So if we do not check these things, maybe we'll sit here, we'll be talking about sanitation. But it's like COVID.
Yes.
When it started in China, we're like, oh, it's not close to us.
Here.
Oh, it won't come here.
We didn't even think about it.
Oh, did you ever think about it? Did you ever think that it was going to be locked down?
We just thought, oh, okay, it's a flu.
Yes.
It's a flu like SARS. You know, it's just like SARS.
So it's
because with SARS, we actually watched it from our homes.
So it may look very far away from you, but it can eventually get to you, because it's like a supply chain.
Yeah.
There's a process from the producer or the manufacturer. It will eventually get to the consumer or the user or the customer. So if we do not curb it somewhere, we do not control how we are transferring that bacteria from one place to the other, by way of getting our surroundings clean and doing what is right, investing in it, and getting our sanitation officers to work, I don't think we'll get anywhere. But anyway, that's the Walantu community. This has been the sanitation focus here on Channel One TV on Breakfast Daily. We take a quick break. When we come back,